Welcome to the Ottawa Birth and Wellness Centre. We opened our doors in 2014 and admit over 350 clients per year. We have over 50 midwives credentialed with us here at the Birth Centre. Our clients are residents of Ontario and must be receiving care with midwives credentialed with the centre. Our clients are low risk, healthy, and experiencing healthy pregnancies, labors, and births. At the time of labor, their babies must be full term, they must be carrying one baby on board, and it must be head down.
Welcome to the Ottawa Paramedic Service headquarters. Formed in 2001, we currently employ more than 650 employees, including 550 certified paramedics, and we continue to grow. In order to respond to 150,000 emergency calls per year, we deploy up to 50 transport vehicles and more than 12 first response units at peak times. Our assets are deployed throughout the city from our headquarters, located near Walkley and Conroy. We pride ourselves on providing progressive paramedic care in our nation's capital.
Although we are very proud of our relationship with the Ottawa Paramedic Service, the majority of our transfers do not require transport by ambulance. In 2018-2019, more than half of our transfers were done so by private vehicle. Of the clients that do require transport to hospital, less than 3% are considered critical.
In most cases, transfer to hospital are for non-urgent reasons, such as slow progress, epidurals, or meconium. Despite this, there are circumstances that require emergency paramedic support and transport. The purpose of this video is to highlight the complex systems at play when paramedic support is needed. We're now going to demonstrate a situation where paramedic transport and support is required.
A birthing center client is 8 centimeters dilated and reports an urge to push. The client is term 40 plus 1 weeks, G3P1, GBS negative, and planning a birth center birth. The client is attended to by 2 midwives preparing for the birth. Ontario midwives have a 4-year BSc degree program, are a regulated healthcare professional under the College of Midwives of Ontario. They provide clinical care during their pregnancy, labor and birth, and 6 weeks postpartum. They must undergo robust continuing education initiatives, including yearly neonatal resuscitation, 3 professional development activities, 6 peer case reviews, every 2 years, CPR, emergency skills, and fetal health surveillance in labor research, and then PRN, peer case reviews, and quality of care reviews. Ontario studies have demonstrated that C-section rates are greatly reduced when under the care of a midwife. Coming back to our scenario, during auscultation of the fetal heart rate, the midwife notes a deceleration and instructs the client to change position and reassesses the heart rate. The midwife has noted that there is a second deceleration and instructs the birth center aide, also known as a BCA, to call 911. BCAs provide non-clinical support and assist midwives in emergencies by calling 911, assisting with documentation, fetching equipment, and receiving paramedics. Their training includes CPR and first aid, a specific BCA training program, and specific operational training. When calling 911, we prefer to use the landline as it contains greater contact information. 911 communication officers have been contacted and the closest ambulance has been dispatched and proceeds to the center, high priority, lights and sirens. Paramedics at the Ottawa Paramedic Service possess one of 2 levels of care. The first level of care is that of a primary care paramedic, or PCP. They possess a 2-year college diploma. They are provincially certified. They go through 48 hours of annual continuing education and are certified by a physician to perform controlled medical acts. Primary care paramedics are certified to perform controlled acts that assist with airway and breathing, such as CPAP therapy, LMA, OPA, NPA, suctioning, and monitoring. They can assist with cardiac issues. They can assist with bleeding. It is important to note that PCPs can only perform IVs under ACP supervision. Primary care paramedics can provide medications that pertain to non-narcotic pain management, cardiac emergencies, anaphylactic emergencies, diabetic emergencies, respiratory emergencies, nausea and vomiting, narcotic overdose, as well as administering oxygen. The second level of care at the Ottawa Paramedic Service is that of an Advanced Care Paramedic, or ACP. This requires an additional year of college, 56 hours of annual continuing education, and the program is CMA accredited. In addition to PCP procedures, Advanced Care Paramedics are certified to provide additional controlled acts, such as endotracheal and nasotracheal intubation, intravenous therapy or intraosseous therapy, as well as a greater variety of advanced treatments for emergency situations. In addition to PCP medications, Advanced Care Paramedics can provide additional medications for narcotic pain relief, sedation or seizures, additional cardiac medications, fluid therapy, additional diabetic treatment, as well as other medications in order to treat a diverse range of emergency conditions. Paramedics arrive at the birthing center via the east entrance, which can be found off of Walkley Road, east of Saint Laurent Boulevard. Typically, paramedics will be greeted by a BCA or birth center aide who will escort them to the birthing room and provide them with a report. Upon entering the birthing room, paramedics make contact with the midwife. After communicating with the midwife and obtaining confirmation of registration, the paramedic crew prepares their equipment and then works cooperatively with the midwife in assessing the patient, making decisions, and providing patient care. According to the BLS standard on regulated health professionals, the patient is under the care of the midwife with paramedic assistance only upon request and within the scope in which the paramedic is authorized. Midwives have access to excellent neonatal resuscitation equipment on site or when attending a home birth. They can use either a bag and mask, anesthesia bag, or T-piece resuscitator in order to provide 21% oxygen as per NRP guidelines. They have access to advanced airway equipment such as intubation and LMA. They can perform umbilical vein catheterization, and typically the medication will be provided and drawn up by the midwife. Midwives also have equipment to warm the infant, such as the infant warming mattress. It is important to keep in mind that a transition to 100% oxygen will probably have to be made during transport. The midwives and paramedics have determined that the neonate requires emergency transport. Paramedics should follow the transport direction of the midwife in consideration of their privileges and/or the patient condition. For example, non-critical transports should be sent to the midwives' privileged hospital, such as the Civic or the Montfort Hospital in Ottawa. Typically, critical transports will either go to the General Hospital or CHEO if they're coming from the birthing center, or it is up to the discretion of the attending midwife in the case of a home or community birth. Although the destination is decided by the midwife, it is important that this is a collaborative approach and that paramedics express their views and concerns when making this decision. In our scenario, the neonate is transported to CHEO with ongoing respiratory support. After the neonate is handed off to hospital staff, it is important that key information is provided to the midwife and paramedics. Paramedics must provide the midwife with a copy of the vital signs taken during the call. Paramedics must also obtain all the prerequisite information in order to properly fill out an ambulance call report as per the current Ontario ambulance documentation standards. This includes, but is not limited to, patient demographics, medical background, treatment prior to arrival, and treatment during care.
Thank you for watching. We hope you enjoyed our video. There are a couple of take-home points we would like you to remember.
Upon arrival at the scene, it is important that the midwife identify themselves.
Patient care is done in a collaborative manner, appreciating the skills that each profession brings to the table.
All decisions are made in the patient's best interest. It's also important to remain professional and to respect confidentiality.